Very good morning, folks. Welcome to the microbiology, infectious disease, immunology class. Immunology and infectious disease. We primarily here studying about HIV and AIDS. Quickly, we will go what all we have. HIV for antigens, antibody, and nucleic acids. So there will be no repeats. If you want, you can just replay the video or the YouTube or whatever you wanted to listen. But I'll quickly read. HIV for antigens, you do ELISA and immunofluorescence. Antibodies, ELISA and Western blots. Nucleic acid test, you do Southern blot as well as DNA amplification. Both are done by PCR. Screening for HIV is done by ELISA. Rapid antibody 2. Then as well as fourth generation automated antigen antibody combined assay. And you have confirmation test for HIV is Western blots and PCR. And HIV 1 and 2 the differential assay is recommended for a confirmation procedure. Confirmation procedure of the fourth generation HIV assay is PCR. Early detection for documenting infant HIV infection following antiviral therapy. This is the confirmation test you do for HIVs, Western blots, and PCR. Then what is the most likely the most likely test, the bands which you check is bands P24 and G120. That is the precursor protein of GP120 and 141. These are N proteins, and most common is P24 and GP120. Alright, and a woman had 5 pregnancies, subsequent test positive for HIV by Western blot. Reason is interference with the medication. Interpret the test HIV1 and HIV2 positive ELISA, but Western blot is indeterminate, and HIV1 P24 indeterminate. P24 antigen is negative. So what is the answer is additional test is required. Unlikely HIV1 infection. If a patient is having antibody to HIV2 or false positive test, this could be false positive. So false positive ELISA assay. So additional test is required. Next question is next thing is HIV AB negative, but PCR PCR 1 week later. Sorry. Sorry for the interruption. We'll be back again. Talking about the last additional testing is required. Is in the case if the antibodies to the HIV2. This could be due to false positive ELISA assay, and ELISA assay. So additional testing should be HIV AB antibodies are negative, but PCR is 1 week later. 1 week is required for additional testing. And another question is HIV PCR. If antibody tests for HIV is negative, but PCR 1 week later is positive. HIV antibody test is negative, but PCR test is 1 week later. What is the reason? Is the window period is reduced a few weeks by sensitive immunoassay. The antibodies or Why it is sensitively positive for after 1 week is because of the window period, and is it should be tested. The HIV disease should be tested several weeks again. Also, it's a must. Also, we talk about methods for HIV identification. Signal amplification technique is branched chain DNA analysis is a method, and classification, importance of classification system of HIV infection is a combination of CD4 positive T cell count, helper T cells, and various categories of clinical symptoms important in determining the treatment options and the progressiveness of the disease. Then we talk about the development of HIV vaccine is primarily because of the genetic diversity of different strains constantly emerging. That is the thing, and we have HIV-1 M main virus, 9 subgroups A to J except T, and O outlier the nucleotide sequence GAG gene, and N non-M and non-O, and P subtype is SIV GOR related, and still a vaccine is yet to be for all subtypes of HIV-1. Okay, so the next question we have is in monitoring HIV infected patients, which parameter most sensitive indicator is HIV viral load of the antiretroviral treatment. Effectiveness of antiretroviral treatment is HIV viral load. All right, then we have CD4 and CD8 ratio is should be 1:2, less than or 1:0. Common finding in AIDS patients are CDC and prevention CD4 positive helper T cells less than 200 and microliter or 14% in the absence of HIV AIDS defining illness, example pneumocystis coronary pneumonia. All right, then you have in case of the newborn tested for vertical HIV infection, HIV PCR. All right, from HIV infected mothers is HIV PCR. Advantage of 4th generation rapid HIV test from earlier HIV rapid test or T24 antigen. Method for test for HIV of in infects who are been born by HIV positive mother is PCR. That's what we read, and that's all we have on HIV AIDS, immunology, infectious disease. Happy studying, students. Hi, hello. Also for the COVID, in the wake of COVID and outcome of the people have come out of the COVID-19 virus, and it's like a 1919 flu virus wake up. Many are aware, are conscious, and to know. As a microbiologist, I wanted to share that this information that we have the lots of stuff, unlike previous days, that information like QR code, the barcode, and all those things have come up. We can make use of that information. There is I'm just putting a clip on this particular talk. Maybe because we wanted to be academic students, and we wanted to be have lots of information that the academic university are going to be very different from the students' perspective sometimes. For those people, it will be useful. I hope this talk you can listen. Jesus, thank you for listening.